Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 164 of our Pharmacotherapy MCQ series, which majors in infectious diseases. And the first question reads, TTK, the mother of a 2-month-old infant is refusing her physician's advice to administer immunizations to her child after reading in Good Housekeeping and hearing on The View that vaccination may result in autism. So my question to you is, which of the following would be the best advice to TTK? Would it be A. Suggest that she is wrong about the link between autism and vaccinations, report the mother to the Department of Health and Human Services for endangering her child, or B. Recommend that she wait to immunize the child until the child is 10 years old because the child will only need a serogroup B meningococcal vaccine, or C. Recommend that the child be immunized because the risk of autism is significantly lower than the risk of the child dying or having long-term sequelae from an infection with an organism that causes meningitis, or would it be D. Suggest that she is correct and that all vaccines should be avoided? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is C. Recommend that the child be immunized because the risk of autism is significantly lower than the risk of the child dying or having long-term sequelae from an infection with an organism that causes meningitis. The link between autism and vaccinations has been talked about within the media for over a decade. Studies have shown that neurological outcomes do not differ between children who receive immunizations and those who do not, therefore, answer D is incorrect. Answer B is incorrect because there is no indication that the child is immunocompromised. Answer A, though tempting, is incorrect because parents should be educated about the risks of choosing whether to vaccinate their children. Therefore, answer C is correct. Please advance to the next question. And the next question reads, XBA, a 34-year-old female patient with a height of 64 inches and a weight of 60 kilograms presents to your accident and emergency department with confusion, headache, and a body temperature of 38.6 degrees Celsius. Her pertinent labs are all within normal limits except for a WBC of 21 × 10⁻³ cells per millimeter cubed. A head CT is done and it is negative for hemorrhage, edema, and sinusitis. A lumbar puncture is done and it shows elevated opening pressure, a WBC 1100 cells per millimeter cubed with 95% neutrophils, glucose 35 mg per deciliter, it is 120 mg per deciliter in the serum, and protein 250 mg per deciliter. Her gram stain is pending. So my question to you is, which of the following is the most likely cause of community-acquired meningitis in XBA? Is it A. Group B Streptococcus, or B. Staphylococcus aureus, or C. Listeria monocytogenes, or is it D. Streptococcus pneumoniae? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is D. Streptococcus pneumoniae. Answer D is correct because Streptococcus pneumoniae is the most common cause of meningitis in adults of this age group. Answer C. Listeria monocytogenes is more common in infants and adults older than 65. Answer B. Staphylococcus aureus is more common in healthcare-associated meningitis, and answer A. Group B. Streptococcus meningitis is more common in newborns. Please progress to the next question. And the next question reads, JKA, a 6-month-old girl is rushed to your pediatric accident and emergency department with a temperature of 39.4 degrees Celsius, seizures, and decreased mentation. Her lumbar puncture shows elevated opening pressure, a WBC of 1500 cells per millimeter cubed with 98% neutrophils, glucose 30 mg per deciliter, and it is 100 mg per deciliter in the serum, and protein 285 mg per deciliter. Her gram stain is still pending. So my question to you is, which of the following statements is most accurate regarding JKA's case? Is it A. The patient meets the criteria for viral encephalitis, therefore, antibiotic therapy should be avoided, or B. The patient meets the criteria for having a strong risk of community-acquired bacterial meningitis, therefore, therapy should begin immediately, or C. According to the Centers for Disease Control and Prevention, National Healthcare Safety Network definition, the patient has healthcare-associated meningitis and should be initiated on broad-spectrum antibiotics, or is it D. Given the patient's bacterial meningitis score, she should not receive antibiotic therapy? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is B. The patient meets the criteria for having a strong risk of community-acquired bacterial meningitis, therefore, therapy should begin immediately. Answer B is correct because the lumbar puncture reveals all the signs of bacterial meningitis, therefore, therapy should begin immediately. Answer D is incorrect because the patient actually meets 2 of the criteria for bacterial meningitis, according to the scoring system, therefore, she should receive therapy. Answer C is incorrect because by definition, the patient has no indication of acquiring this infection in the healthcare setting. Answer A is incorrect because the lumbar puncture is consistent with bacterial, not viral, meningitis. Please proceed to the next question. And the next question reads, WAT, a 23-year-old male patient presents to your accident and emergency department with a body temperature of 39.3 degrees Celsius, vomiting, and decreased level of alertness. He has a past medical history significant for hydrocephalus since childhood, requiring placement of an internal CSF shunt. On admission, his WBC is 28 × 10⁻³ cells per millimeter cubed. His MRI shows no brain shift, however, ventriculitis is present. His lumbar puncture has the following results: opening pressure is increased, WBC is 1.2 × 10⁻³ cells per millimeter cubed with 90% neutrophils, protein is 200 mg per deciliter, and glucose is 30 mg per deciliter. His gram stain is positive for gram-negative rods. So my question to you is, which of the statement listed below is most accurate? Is it A. The patient meets the criteria for viral encephalitis, therefore, antibiotic therapy should be avoided, or B. The patient meets the criteria for having a strong risk of community-acquired bacterial meningitis, therefore, therapy should begin immediately, or C. According to the CDC, National Healthcare Safety Network definition, the patient has healthcare-associated meningitis and should be initiated on broad-spectrum antibiotics, or is it D. Given the bacterial meningitis score, the patient should not receive antibiotic therapy? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is C. According to the CDC, National Healthcare Safety Network definition, the patient has healthcare-associated meningitis and should be initiated on broad-spectrum antibiotics. Answer C is correct because the CSF culture is positive in the presence of a risk factor for healthcare-associated meningitis, that is, the presence of a CSF shunt. In addition, the lumbar puncture reveals all the signs of bacterial meningitis, therefore, broad-spectrum therapy should begin immediately. Answer D is incorrect because the bacterial meningitis score is used in children with suspected community-acquired meningitis. Answer B is incorrect because, by definition, the patient has health-care-associated, not community-acquired, meningitis. Answer A is incorrect because the lumbar puncture is consistent with bacterial, not viral, meningitis. Kindly advance to the next question. And the next question reads, EAK, a 25-year-old female patient with a height of 65 inches, and a weight of 65 kilograms presents to your accident and emergency department. Her signs and symptoms include vomiting, headache, and increased somnolence and a body temperature of 38.8 degrees Celsius. A provisional diagnosis of suspected health-care-associated meningitis secondary to recent neurosurgery is made. Her pertinent labs include an elevated serum WBC of 21.43 times 10⁻³ cells per millimeter cubed, a serum creatinine of 0.9 mg per deciliter. Her lumbar puncture shows elevated opening pressure, a WBC 1000 of cells per millimeter cubed, with 97% neutrophils, protein 245 mg per deciliter, and glucose 25 mg per deciliter. So my question to you is, which of the empiric systemic antibiotic regimens listed below would be the most appropriate? Would it be A. Meropenem 2 grams IV thrice daily plus vancomycin 1250 mg IV twice daily, or B. Acyclovir 650 mg IV thrice daily plus ceftriaxone 2 grams IV twice daily plus vancomycin 1 gram IV twice daily, or C. Ceftriaxone 2 grams IV twice daily plus ampicillin 2 grams IV thrice daily, or would it be D. Cefepime 1 gram IV thrice daily plus vancomycin 500 mg IV thrice daily? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is A. Meropenem 2 grams IV thrice daily plus vancomycin 1250 mg IV twice daily. This patient presents with healthcare-associated bacterial meningitis secondary to neurosurgery. All CSF fluid findings are consistent with bacterial meningitis, therefore, appropriate antibiotic agents should be initiated at once. Bacteria of concern include aerobic enteric and non-lactose fermenting gram-negative bacilli such as Escherichia coli and Pseudomonas aeruginosa, Staphylococcus aureus, and Propionibacterium acnes. Hence, the best possible regimen for this patient is answer A, that is, meropenem to cover the potential gram-negatives, including Pseudomonas aeruginosa, and vancomycin to cover Staphylococcus aureus, including methicillin-resistant Staphylococcus aureus. Answer D is incorrect because the dosing of the antibiotics is inappropriate. Answers B and C are incorrect because they lack appropriate coverage of bacteria. Please advance to the next question. And the next question reads, which would be most appropriate regarding therapy duration had the culture in EAK's case been positive for Pseudomonas aeruginosa? Would it be A. Treat for 3 weeks total with IV antibiotics, or B. Treat for 2 weeks with IV antibiotics, then for an additional 1 week with oral antibiotics, or C. Treat for 1 week with IV antibiotics, then for an additional 1 week with oral antibiotics, or would it be D. Treat for 1 week total with IV antibiotics? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is A. Treat for 3 weeks total with IV antibiotics. Answer A is correct because in patients with gram-negative bacilli, including Pseudomonas aeruginosa, therapy duration should be at least 21 days, with intravenous antibiotics. That makes answers B to D incorrect. Please advance to the next question. And the next question reads, FJA, a 36-year-old male patient with a height of 72 inches, and a weight of 78 kilograms presents to your accident and emergency department with a chief complaint of severe headaches. His vitals and labs include, a body temperature of 39.2 degrees Celsius, a WBC 18 × 10⁻³ cells per millimeter cubed. His lumbar puncture shows an opening pressure of 300 mm of water, a WBC of 1780 cells per millimeter cubed with 97% neutrophils, protein 300 mg per deciliter, and CSF to serum glucose ratio of 0.22. So my question to you is, which would be best to initiate in FJA's clinical scenario? Would it be A. Acyclovir 750 mg IV thrice daily, or B. Ceftriaxone 2 grams IV twice daily plus vancomycin 1500 mg IV twice daily, or C. Dexamethasone 10 mg IV 4 times daily plus ceftriaxone 2 grams IV twice daily plus vancomycin 1500 mg IV twice daily, or would it be D. Dexamethasone 12 mg IV 4 times daily plus ceftriaxone 2 grams IV twice daily plus vancomycin 750 mg IV thrice daily? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is C. Dexamethasone 10 mg IV 4 times daily plus ceftriaxone 2 grams IV twice daily plus vancomycin 1500 mg IV twice daily. This patient presents with community-acquired meningitis. The high opening pressure and CSF analyses suggest a bacterial etiology, of which the most prevalent pathogen for this patient's risk factors and age is Streptococcus pneumoniae. Because cultures are not done at this time, empiric therapy must include all the potential causative organisms, that is, Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza. Administering dexamethasone, dosed at 0.15 mg per kilogram intravenously every 6 hours with a maximum of 10 mg intravenously every 6 hours together with antibiotic therapy will decrease mortality in patients with Streptococcus pneumoniae meningitis. That makes answer C correct. Answer D is incorrect because both the dexamethasone and the vancomycin dosing are incorrect. Answer B is incorrect because it lacks dexamethasone therapy. Administering acyclovir would be inappropriate because the patient does not have HSV encephalitis. That makes answer A incorrect. Kindly advance to the next slide. And the next question reads, FTA, a 27-year-old male patient with a height of 70 inches, and a weight of 68 kilograms presents to your accident and emergency department from home, with a chief complaint of severe headaches, excessive somnolence, and fevers. On admission, he is febrile with a body temperature of 39 degrees Celsius. His physical exam is unremarkable, except for lesions around his genitalia. His MRI shows edema in the right temporal lobe region. His CSF analysis reveals a normal opening pressure, a WBC of 5 cells per millimeter cubed with 90% lymphocytes, protein 45 mg per deciliter, and glucose 72 mg per deciliter. So my question to you is, which of the following would be most appropriate to initiate in FTA now? Would it be A. Acyclovir 700 mg IV thrice daily, or B. Ampicillin 2 grams IV 4 times daily plus cefepime 2 grams IV twice daily plus vancomycin 1250 mg IV twice daily, or C. Ceftriaxone 2 grams IV twice daily plus vancomycin 1250 mg IV twice daily, or would it be D. Dexamethasone 10 mg IV 4 times daily plus ceftriaxone 2 grams IV twice daily plus vancomycin 1250 mg IV twice daily? I will give you 10 seconds to choose the correct answer to this question from the listed options. And the correct answer is A. Acyclovir 700 mg IV thrice daily. This patient presents with viral encephalitis, probably caused by HSV1. Given the presenting symptoms, together with the hallmark MRI finding and lesions on the genitalia, HSV is the most likely cause. The normal opening pressure and CSF analyses suggest a viral etiology, of which the most prevalent pathogen for this patient's risk factors is HSV. Administering any antibiotic therapy in this patient is inappropriate because the cause of this infection is viral, therefore, answers B to D are incorrect. This patient should be initiated on acyclovir as soon as possible. That makes answer A correct. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 165.